Staffing must ensure the effective match between patient needs and nurse competencies. We implemented appropriate staffing in our ICU in a number of different ways. First, we really looked at making sure that we had the right nurse meet the right patient and pairing them together. We redesigned our device orientation timeline, and we engaged our experienced nurses at the bedside to assist with teaching our new team members our mechanical circulatory support devices. Second, we collaborated with other areas such as the emergency room and other ICUs when we needed additional nurses so that we could continue to staff safely to meet our patient needs and really deliver that high quality nursing care that we all want to provide and that our patients expect of us. And then third, we implemented a tiered staffing model by collaborating with our progressive care nurses to create a team model approach to patient care. I think simply just trying to meet our patient needs in terms of creating a safe environment for our patients and appropriately staffing those patient assignments. It really started out as a necessity during COVID because our existing processes were no longer able to fully meet the demand of our patient volume and our patient acuity. And so we recognized that we had to really reassess what we were doing and create a sustainable plan for the future. The first thing we did was just to ensure that the nurse competencies match our patient needs. As we kind of discussed, we restructured our device orientation timeline and really started to look at what was our core nursing strengths on the unit. It felt natural to tap into those strengths and give our nurses a voice to help with the device curriculum and assist with the teaching of new team members to these devices. We implemented a twice-a-day phone call between the ICU charge nurses, our ICU leadership team, and the nursing coordinators. And that call gave our charge nurses a platform and a voice so that they could escalate their patient safety concerns. They could discuss any sort of staffing or acuity concerns that they had. And then as a team, as a community, we could troubleshoot and figure out how to address those concerns. And then when it came to our tiered staffing model, our unit NPDS created a document for our team that gave guidance on delegating roles and responsibilities for both the ICU nurses and the progressive care nurses. And we combined that document with our ICU standards of care to really give guidance for all team members on how to utilize that team nursing approach. I think, our overall impact of our project is that it allowed to safely meet the needs of our patients, and it did enhance our communication and collaboration with other departments. And then, we've looked at our charting and have leveraged technology to really evaluate what is value added with our charting and what is unnecessary to kind of decrease the amount of workload on our individual nurses. The advice that I would give to someone who's just starting to assess their work environment, number one, just establish a baseline. Identify your nursing team strengths and lean into those strengths. Also, utilize the resources that are available, like the Healthy Work Environment Assessment tool. I think sometimes as leaders, we look at our areas that we work on and say, okay, this is a problem. And the reality is, while that may be true, it might not be the most important problem to our teams. And so being able to pinpoint with these, like for instance, the assessment tool, what the true problem is that's meaningful to your teams will help you to really strategize and say, okay, what are we going to work on now and what can we work on in the future?
Each of the 6 healthy work environment standards includes a list of critical elements. In this project example of appropriate staffing, Christiana Care made sure that staffing policies that are solidly grounded in ethical principles were in place to support the professional obligation of nurses to provide high-quality care, even during the COVID-19 pandemic. They also adopted new ways to increase effectiveness in nursing care delivery by engaging their nurses in the selection, adaptation, and evaluation of new staffing strategies. Nurses engaged in a team approach to education. They restructured their device orientation timeline and designed a new tiered staffing model. Each member of the team participated in the staffing process from education and planning to matching nurse competencies with patient needs. They each seek opportunities to obtain knowledge and skills that demonstrate competence to ensure an effective match with the needs of their patients and their families.